In terms of red flags, as it were, that we should be looking out for, you talked about sort of signs earlier on. What sort of signs or red flags should we be looking out for, and how do we respond?
So I know that it's important for us here to be clear and so we'll give the definition is around somebody who is showing signs over a prolonged period. So I think that that's something that we have to be very clear on here in terms of when we say about coaches. We're not expecting our coaches or your coaches within your clubs to start trying to diagnose or to start trying to look into every participant or every player at the club. This isn't obviously the purpose of what we're trying to enforce here or inform. So what is the technical terminology?
Okay. So from like a GP's perspective, if we're looking for, what did you say, red flags? So a GP would look for a consistently low mood for 2 or more weeks. In a young person, if you work with children in your club, that might be longer because obviously there's lots of hormones coming into action. So moods are more changeable in young people. But if you were going to go to a GP and expect a diagnosis, they would look for a consistently low mood for 2 or more weeks, as well as that person no longer enjoying activities that they used to find enjoyable. So I think if you're talking about people that are coming to your club and you feel, okay, they didn't see themselves today, we'll see how they are next week. If next week they still don't see themselves, maybe give it another week. Okay, so then we're getting into week 3. They still don't see themselves. So then that mood has been consistent and that might constitute as a red flag. If you're working with young people, I talk a lot about young people because it's so much harder to recognize these signs in a young person. I mean, one day they'll like football, the next day they want to go and do something else. But if it's kind of that social withdrawal as a whole, so they no longer engage with friends, they no longer engage with family, they no longer want to play any sport, then again, that would be a red flag. For lots of mental health illnesses, including anxiety disorders, depression, even psychosis, social withdrawal can be one of the first things that someone else might notice. And of course, if that person is socially withdrawing, they are not engaging with people, so fewer people are likely to notice. So don't ever think that, oh, I don't want to hassle them, or, they haven't been for a few weeks, I don't want to hassle them and see where they are. Again, you could potentially be saving someone's life. You never know what's going on for someone, so just don't be afraid to have that conversation with them.
And what I would say there is if you feel that you're seeing some of these red flags and you identify that you feel actually this person has been displaying symptoms for maybe a few weeks, is to then start to think about the approach and how you would then approach. So to consider obviously privacy, not to approach them in front of other people. So then if you are going to identify that as an opportunity to have that conversation, try and find enough time for it. I appreciate, obviously, in a coaching environment, as we mentioned earlier, it might be that if you're the head coach or if you know the lead coach is looking after something, then it can be daunting because you're looking after running a whole session, getting there early, setting up, doing all the work, taking everything down at the end. And you don't want to feel like you're not giving that person enough time. So it might be that is something that needs to be identified at the end of a session, but identified that you've got enough time to then have that conversation. So yeah, they're just some things to factor in when you do start to see those red flags, those things that are really clear to you as a coach, or something that you might consider to then actually think about, how am I going to approach this in a manner that allows that person to feel comfortable and in control.
Mm-hmm. Yeah, definitely. I totally agree with Gath. I think approaching that person and then listening to them without judgment are probably the 2 most important things that we'd stress. And then from that conversation that you facilitate with that person, you can go from there. If you think that person is okay, you'll just monitor them over the next few weeks and form that relationship with them, then that's absolutely fine. But if you do feel that they need more appropriate and more professional help, then don't be afraid to recommend that to the person that you're talking to.